everybody. This is Deanna Minnick. Welcome to the Detox Summit. Today, our special guest is Dr. Mary Ellen Chalmers. Dr. Chalmers is a dentist in group practice in Santa Rosa, California. And I know that many of you are going to find her a delight because this is really what we want to know. One of the sources of toxins that we're exposed to is the toxins in our mouth. And so Dr. Chalmers has a beautiful background of not just dentistry, and that by itself is a lot. It's a mouthful, right? But a very specific form of dentistry in dental medicine, which is functional medicine combined with the art of dentistry. And she also has a background in naturopathic medicine, and that's something a little bit new. I did not know that about you. So we're going to talk about the toxins in the mouth and what you can do, and Dr. Chalmers will guide the way towards a better understanding of amalgams. So welcome, Dr. Chalmers, to the Detox Summit.
Thank you, Deanna. I am absolutely thrilled to be here and have an opportunity to give what I think is a little bit of a unique perspective on this very controversial topic about silver amalgam.
Yes, it is very unique. It's, even this whole idea, and perhaps you can explain for all of the listeners, this might be a new field that not many people know about, but what is functional dental medicine? I'm curious how many people have even heard of that before.
Well, and I think probably not many, given that there's a handful of dentists that have been educated through the Institute of Functional Medicine. But functional dental medicine, or functional dentistry as I call it, I think it really originated with Richard Hansen, who was the first dentist to take the applied functional medicine in clinical practice residency, I think back in 2006 or 2007. And he kind of developed this concept. I met Richard in April of 2008 when we were both speaking at a conference together, and did my applied functional medicine clinical practice residency in December. And at that conference, Dr. John Klein, who made a statement that standard American dentistry can be an antecedent or a trigger for chronic disease. And that simple statement completely turned my thinking around. I mean, up until then, I very much practiced from the perspective that my job as a dentist was to reduce inflammation in the mouth. I think you remember it was 2004, that Time magazine article where they talked about inflammation as the secret killer. And I thought about, how are we contributing to inflammation in the mouth with the fillings that we put in, and chronic periodontal disease and things like that. But when Dr. Klein made that statement, and I started learning the functional medicine model, which is, of course, about antecedents, triggers, and mediators. Antecedents are things that exist in our body and set the stage for chronic disease. Triggers are things that can trigger a crisis. I mean, the way I have patients come in and say, I was fine until I had that. I was amalgams taken out without precaution, or I was fine until I had that root canal placed. And then mediators are the things that exist that keep things going. So when I started thinking about the mouth and about the different conditions that can exist in the mouth from that perspective, everything changed. And the problem is, there are two different camps, I think, in dentistry. You have your evidence-based dentists who believe that the way we're practicing dentistry now is really the best route to health. And then you have the biological dentists who do a wonderful job with trying to address some of the toxic issues that we experience in dentistry. But there's an absoluteness. All amalgams, well, I do believe mercury is bad, but all amalgams need to come out. All root canals are bad. They all need to come out. You shouldn't have implants placed. Every surgery site, the cavitations and osteonecrosis and jaw infections all need to be treated. And what functional medicine does is it bridges that gap. It really allows us to determine what's appropriate for that patient because it's patient-centered. So when you put functional medicine and have it as a bridge between medicine and dentistry, what the question becomes, is the patient a candidate? Is this patient affected by the amalgams that are in their mouth, by the root canals that are in their mouth? Does that periodontal disease have a systemic effect? Mm-hmm. So it really, it gives us a very unique perspective.
I almost liken it, I've heard of that phrase, I'm sure you have before, the eyes are the windows to the soul. And I think that the mouth is the window into the body, in so many ways, because we can tell so much about a person's health by looking at the state of the gums, the teeth, the tongue even. Around the mouth, we can tell so much about nutrient deficiencies, and it's all right there if we know how to read that map.
It absolutely is. And in addition to that, I completely agree with you. And in addition to that, really, when we talk about, I think, was it Melnichuk, talked about, death begins in the colon, mm-hmm. or the gut. I used to chuckle. When I first went, in 2008, when I first took that first class at IFM, they started talking about the gut, and, it stopped at the top of the esophagus. And now, of course, it's all different. We talk about the mouth, but really the gut begins, digestion begins in the mouth.
Yes.
And, the pharmaceuticals that have side effects, and the patients that are affected by dry mouth, their salivary flow is compromised. And so they're not secreting those digestive proteins that begin the digestive process in the mouth. And how does that affect the gut all the way down? So not only, I think it was Donna Shalala back in 2000 when she was President Clinton's Secretary of Health and Human Services. She said, you cannot consider yourself healthy. Oral health is integral to general health, and that a person can't consider themselves healthy unless they have true oral health.
So what if you had somebody come into your office and you examine them and they happen to be the epitome of good oral health and having a great mouth, great teeth, great gums? What would that look like? Just so that we know kind of on the other side of the spectrum what we need to aspire to, or what would a dentist like you be looking for?
Well, I described this once. When I look at a mouth, I try to look for a mouth that's at peace. That, and it isn't so much dictated by whether they have amalgam or whether they don't have amalgam. Obviously, the mercury is a toxin, but it's more, are the gums red and bleeding? A healthy mouth, the tissues are firm and pink. When you floss or when you toothpick in between your teeth, your gums don't bleed. You have a sweet, fresh breath. You're not concerned about bad breath. When you smile, because there's a spiritual aspect to the mouth as well. There's a lovely little poem that I found, published in 1914, The Value of a Smile. And they talked about what it does for the spirit to just effortlessly be able to smile and know that your smile is pleasing.
Oh, I like that.
Yeah, it's really a cute old little book. The filling materials, that the filling materials are shaped properly and that they flow with what's appropriate for that patient, that their bite is harmonious. There was a couple of articles written actually in 2010. One was Mastication in the Mind, and the other was Occlusion in the Brain, translated from Japan and Germany. And it talks about the importance of cognition, that if our occlusion is altered, if the way our teeth come together, if that is affected in any way, it can affect our thought processes. And that actually patients, one of the papers stated that they did when they evaluated patients in nursing homes, the ones that had the highest rate of dementia were the people with the fewest amount of teeth.
Now, what does that mean exactly? I think that is a new concept. I don't think that many people realize that their bite in their mouth has anything to do with their brain.
Well, there are fibers. There are fibers that attach the teeth to the bone, and they're called the proprioceptive fibers, and they send signals back to the brain that affect cognition. And it's important for a patient to have a well-balanced bite.
So there can be a lot of things that stand in the way of things like a well-balanced bite. And, on the other side of the spectrum, if we look at what would an unhealthy, toxic mouth look like, what should we be looking for there?
All right. So the first thing I look at is when I do my exam, we palpate the head and neck structures. We look for pain in the neck muscles. We look for swollen lymph nodes. We look inside the mouth. We look at the gingival tissues, the gum tissues, and we look at the oral tissues, the mucosa, the tissues on our cheeks. Sometimes if we see lesions there, they can be related to mixed metals. They can be related to old fillings. We do oral cancer exams. Do their gums bleed? Is there a lot of plaque? Can patients floss easily between their teeth? Sometimes I say, every time I eat, I get food trapped in a certain area. And so that's an area of inflammation. We ask them, have you had any root canals? Not that all root canals are bad. Some patients have an immune system that manages the root canals very well. But other times we see patients where there's hidden infections in the jawbones, and we need to evaluate for that. We look for black, pockmarked, and corroded amalgams. There will be a PowerPoint that will accompany this presentation, and there's some pictures in there where you can see patients that have 3 different types of metal crowns and some silver fillings, the mercury amalgams, and you'll see that the amalgams kind of have a blackened surface area, and that's evidence of corrosion. What that tells us is that the metals are talking to each other. It's a little battery. And when you have that kind of a battery, metal ions can be shed and absorbed into the mouth, into the soft tissues, and then in some patients can have an autoimmune response to that. We also consider gluten, and we look for signs of gluten intolerance.
Now, what would those look like in the mouth? How would you know if somebody had gluten intolerance?
Gluten, I like to talk about it as a leaky mouth. I mean, when we think that from a cellular point of perspective, the formal term is a histological perspective, the oral tissues are very similar to that of the gut. So the way I have considered it is, why would we think that when we talk about leaky gut as a result of gluten sensitivity or gluten intolerance, why would we think that phenomenon is strictly relegated to the small intestine? Mm-hmm. So we look at patients with high decay rates. That's been documented in the literature that a high decay rate sometimes can be as a result of gluten sensitivity. What the gluten can do is trigger an inflammatory state. And one of the emerging concepts in dental decay is that decay may actually be a result of inflammation. For years, we've considered that decay happens because of bacteria. You eat too much sugar, the sugar feeds the bacteria, the acids produced by the bacteria break down the teeth, and then you get tooth decay. But I see plenty of patients who eat a lot of sugar, who don't take very good care of their mouth, and yet they don't have any issues with decay at all, where I have others who we can't seem to get control of the decay in spite of impeccable home care. So clearly, inflammation is at play here. There are white spots, certain hypocalcification, little white spots on teeth can sometimes be an indicator that the patient is gluten sensitive. Lack of salivary flow. There's a strong correlation between Sjogren's syndrome and which is an autoimmune disease, and gluten intolerance or celiac disease. So that's just some of the ways that we keep in the back of our mind when we're evaluating a patient. But it's very interesting. We've started saying to patients who've had tremendous issues with decay, and in spite of watching their diet and brushing their teeth, we can't seem to get the decay to stop. We've actually been testing them for gluten sensitivity, or suggesting that they see their medical provider for gluten testing. And it's interesting how many that we see come back with gluten issues.
Interesting. Any other food triggers that you see a connection with the mouth? whether dairy or acids that we take in?
Acids is a big thing, and this is one of the very important things, especially if you have mercury amalgams. An acidic diet goes a long way towards promoting an oral environment that's going to lead to corrosion and is going to have the interactions between the metals, because a lot of us have metal crowns with amalgams right next door, and the different gradient of the metals with an acidic diet makes a big difference in terms of whether they're going to be a problem. Another thing that's a real problem, frankly, is carbonated soft drinks. Mm-hmm. Both in terms of how it affects the pH of the mouth and also what it does to tooth mineralization.
Yes.
So one of the things when you're talking about what we look for in a healthy mouth, we always, on every patient, we evaluate salivary pH. We have our little pH test strips, and we try to, if we can see about a 6.8 or a 7 salivary pH, we're really encouraging that patient and telling them they're doing a great job. Likewise, if we see a salivary pH of about 6, 6.2, or even below 6, occasionally we'll see it in the 5s, then we immediately begin to counsel that patient on their diet or refer to a nutritionist to have them do so, because it's critically important for their health.
So talk with us about one of the biggest offenders in the toxic realm as it relates to the mouth, amalgams. Give us the skinny on if we have amalgams, are we just automatically considered to be toxic? Is that a done deal? Do we get them removed? What do we replace them with? How soon do we do that? How do we do that? I know that I have so many questions in my mind, which means that probably a lot of the listeners do too.
Well, amalgams the amalgam is a long-standing controversy within the dental profession. The American Dental Association has always maintained for years that amalgam is a long-lasting, safe material that, when placed in the mouth, is inert. And I think there are certain parts of that statement that are absolutely true. Amalgams are very inexpensive to place. They do last a long time. But I think that the science is now pretty clear that the amalgams, once placed in our mouth, are not inert. The real issue is, and this is where functional medicine makes such a difference, the real issue is, do we have a patient that can manage the mercury that's being discharged by these amalgams? And how much mercury is being discharged is going to be affected by their diet. It's going to be affected by, are there other metals in the mouth that can contribute to an accelerated breakdown? What's their salivary pH? I mean, there's a lot of factors. Stress affects salivary flow. Are they taking any pharmaceutical medications? If we have a decreased salivary flow, then that's also going to have an effect on how sticky the plaque becomes and whether plaque is going to stick. And again, that speaks to, the pH and the whole oral environment. So, for example, Dr. Oz did a great presentation on amalgam a year ago. And I would encourage, if anybody, people can also take a look at that. I believe he has it online. But at the end of the day, they showed that they used a Jerome vaporometer to show that these amalgams are not inert and that, in fact, mercury vapor is released. And if you go and you take a look at my presentation, you'll see a short video there produced by Dr. Tom McGuire, where he used the same thing, and he used the Jerome mercury vapor and took it and scrubbed the top of an amalgam with a toothbrush, something we all do, right? We all brush our teeth, and showed the release of mercury vapor. So that it's one of the most important things to recognize is that these materials are not inert. So then the overriding question becomes, well, how hazardous are they for me? And, at the end of Dr. Oz's presentation, the two dentists there did a great job explaining what some of the hazards are. They said, at the end of the day, we just don't know. And I think this is where those of us trained in functional medicine and those who view whether it's the mouth or the rest of the body through the functional medicine lens can really say quite differently, well, I think we do know. What has helped so many of my patients in my practice is that I work very closely with other functional medicine providers. I mean, I do the dentistry and I maintain their oral health, but I have providers that I refer to who can assess whether that patient has a heavy metal toxicity level, whether their levels of heavy metals are high. You know, if we look at whether they have a large number of amalgams, that's something that we need to consider carefully as to whether we need to remove those amalgams or not.
And can you tell us too, what are the times that we are getting the most outgassing of mercury from amalgams in the mouth? So is it, you mentioned brushing the teeth. What
people
about
who
chewing?
Grind? People who grind or brush. Because again, you're putting that friction. The friction is being placed on those amalgams. That's when you're going to have a high level of outgassing. People who consume a high level of acidic foods or carbonated sodas, as I said, those amalgams are going to off-gas. And the other really important thing to consider is whether you've got cardiovascular disease. When they say, well, we really don't know whether they're a problem or not. One of the fundamental things that has changed, I think, in the conversation is that we're beginning to recognize, number one, Dr. Mark Houston published a phenomenal paper on the link between mercury and hypertension. And in this paper, he brilliantly outlined the pathways as to how mercury contributes to endothelial or dysfunction in our blood cells that contributes to coronary heart disease, irregular heartbeat, and stroke. And so that I think any patient with hypertension, cerebrovascular disease, stroke, coronary heart disease, and if they have amalgams, they really need to be evaluated for mercury toxicity. Another thing we've come to understand is that it's the compounding of different toxins that, where maybe a little bit of mercury wasn't an issue if that was the only toxin we're being exposed to. When we compound that with all the other toxins we're now exposed to in everyday life, that little bit of mercury all of a sudden becomes more significant. And I, will often say to patients, I think this is why for years, for good reason, the ADA was able to say, we really don't think it's a problem because they weren't seeing the classic symptoms of mercury toxicity. And, really amalgam was developed in 1850. I think the toxins, life was simpler then. The amount of toxins that people were exposed to isn't the same as what we're exposed to today. So that's another very big shift. And then finally, I think the other thing that allows us to view mercury differently is that we're really beginning to understand what the physiologic effects are. As we look at patients' genetics, we now know that we all have different genes that allow us to eliminate toxins. And people who present with certain kinds of limitations in their ability to detoxify, as evidenced by different gene tests, we begin to think, well, that's someone that maybe should really consider not having this burden in their mouth and affecting the rest of their body.
So what are the first steps that somebody would go through in order to evaluate the amalgams in their mouth? Would they make an appointment with a functional dental expert such as yourself? And then would blood tests be run, or would there just be kind of a straightaway pathway into removing the amalgams? What would be the scenario?
Yeah, the first step, I think, is to find a good dentist. And I've done a lot of work as I do this, as I educate, and as I do a lot of, if I've looked at this issue, the biological dentists have really been at the forefront of saying, oh, we need to get all their amalgams out. However, there's so many patients with amalgams, and this is such a large issue that I don't, from a demographic perspective, only 1% of the dentists in the United States would consider themselves biological dentists. On the other hand, only 50% of the dentists, I've heard statistics between 47 and 50% of the dentists still place amalgam. So there are plenty of really great dentists out there that are no longer placing amalgam. On top of that, the dental schools have really made a shift. I was talking to a recent grad from USC, University of Southern California. She did not have a requirement in dental school to place any amalgams, which is a big shift in terms of the education of our new dentists coming out of school. And I was talking to one of my former professors from Tufts University School of Dental Medicine in Boston, and he mentioned that Tufts has implemented the same policy as well. So, the profession is changing. But one of the critical things that a patient needs to concern themselves with are these fillings being taken out with what we call, the International Academy of Oral Medicine and Toxicology has called precautions, meaning the patient needs to have an outside air source. I mean, in our office, we have our patients on oxygen. The tooth that's being treated needs to be isolated with something called a rubber dam. We're a latex-free office, so it's a piece of nitrile that isolates the tooth from the rest of the oral cavity. It prevents patients from swallowing any of the particles and helps to ensure that the environment is going to remain dry and we're able to better contain the filling as it's being taken out. One of the most important parts of this whole process is the HEPA filter. We have it. Has a large funnel and rests right under the patient's chin. And it sounds like a patient today, as I treated a patient this morning, called it our vacuum cleaner. You're going to turn that vacuum cleaner on.
Right.
Because it basically, as we're removing it, the mercury vapor is sucked down in and right into the HEPA filter and the vapor is trapped in the filters. We have a couple of HEPA filters in the office actually with mercury-specific containers to address the vapor. So it's, and I also want to make the point that it's not only important for the patients, it's critically important for the dentists and their staff because of the chronic toxic exposure to mercury. Our HEPA filter runs, we have a great big one that blasts the office out, and we run it every night on full power just to make sure that we're taking care of the vapor that is released when these fillings are being taken out.
So thank you for walking us through that process. That's really helpful, and it shows the degree of conscientiousness that a dentist has to take, and as well as the staff, in taking a patient through this. It's no easy feat, it sounds like. So I'm curious too, Dr. Chalmers, about not just mercury and the amalgam material, but what about the other materials that we might bring into the mouth, like toothpastes? Are there things that we need to be watching for in personal care products that come into contact with the mouth that are concerning?
Absolutely. One of the biggest problems that we see patient tissue reactions to sodium lauryl sulfate. It's the sudsing agent.
So that's SLS, what you're mentioning?
We see patients that have chronic aphthous ulcers, SLS, and then there are also a few products that have triclosan and the tartar-reducing products. We see a lot of oral tissue issues, chronic oral irritation, and we find that when we get them on a sodium lauryl sulfate-free, chemical-free product, and there are some good ones out there with Jason's. Burt's Bees used to be a good one, but unfortunately they were purchased by Clorox, and they're not making that toothpaste anymore, which is a shame.
I didn't know that. Okay.
Oh, they had a whitening toothpaste that my daughters swore by, and we were sending patients to several of the local supermarkets would carry it for me because that's where we would always send our patients to get it. Yeah. But there's a few good brands out there. You have to read the labels. Some of the brands for a long time that have been thought of as more organic isn't the right word, but more natural. Tom's, for instance, you need to be very careful. Some of the Tom's toothpastes do have SLS, some do not. So you really, it's something that you have to take the time and look at the label, but SLS is a big thing. Whitening and in whitening materials, the sodium, a lot of the tooth bleaching materials address sensitivity because sensitivity is often an issue with whitening by adding nitrites. I don't know about you, but I don't, I'm very careful to buy my meat without nitrites. And to have these trays with potassium nitrite, intuitively, it just doesn't make sense for me. So we had a product that we were using that had amorphous calcium phosphate and was nitrite free, but it was bought by one of the larger manufacturers and the formulation was changed. And so we're on the hunt now for a new bleaching product that doesn't have nitrites.
Wow, I better start looking at my my products a little bit closer. What about just good old-fashioned hydrogen peroxide? I know that some people use that as their form of bleaching, and you find that anyway in a number of those bleaching products. Is that safe for the mouth?
Yeah, hydrogen peroxide, actually, it was Paul Kai's. It was the Kai's technique back in the 80s. Mixing hydrogen peroxide and baking soda was a great way to take care of periodontal disease. And we do recommend that for patients. It's diluted. It's a great anti-inflammatory agent. I can't speak to whether it actually whitens teeth, but in terms of brushing with good old plain old baking soda for people who are chemically sensitive, that's
a good fallback then.
A good fallback, yep, absolutely.
This is such great information. I love the idea of talking about brands and talking about these things to be watching for on the label of these products. And so, you've given us a wealth of information. So I'm just curious if we had to solidify and have 3 takeaways from today based on our discussion, what would you want to leave all of the listeners with as it relates to this whole area of dentistry and detox?
Well, recognize that the mouth is a critically important area to have healthy. That you're not going to be healthy in the rest of your body unless your mouth is healthy. That if you have heavy metals in your mouth, consider whether you might be a candidate to have them removed. If you have any sort of cardiovascular disease, I think that that's something that you should consider. If you have any type of autoimmune disease, I think that's something that you should consider. If you seem to suffer from a lot of oxidative stress, which is like rusting, meaning if you have chronic fatigue, fibromyalgia, it's certainly something that you could consider. One of the most important things that I can say to you is make sure that your amalgams are removed with precautions. And there are several sites on the PowerPoint presentation that will go along with this that will tell you, there's a picture that illustrates what safe removal precautions look like. There are websites to go to get more information. There's actually a video that shows the release of the mercury amalgam and for dentists, how to educate themselves in these procedures, and for patients, where you can direct your dentist. For example, I had a patient a couple of weeks ago that traveled a few hours to see me. She had an infected root canal that her dentist hadn't picked up, and we were able to do that and get her to the surgeon to get it taken care of. However, she had the work that was done in her mouth was beautiful. He did gorgeous fillings and had taken the amalgam out, not with precautions, but had done a beautiful job. And so, if you've got a dentist that does beautiful work, educate them about how to take these amalgams out and how to take them out safely, because not only is it going to benefit you, it's going to benefit them and your staff. And remember that in addition to amalgam, that there are other areas, jawbone infections and hidden root canals. There can be infections in the jawbone that sometimes special x-rays will show whether they're putting a toxic burden on the body or not. And that finally, the best thing you can do is diet. It's fundamental to your oral health. Your B vitamins are critically important, CoQ10, your antioxidants. So your toxic burden, at least from the oral cavity, resolves to a great degree if we eat a good, healthy diet.
Are there, and just to tag on to what you just said there, are there certain nutrients, you just mentioned the B vitamins, antioxidants, and CoQ10? If you were to put together your own special vitamin or mineral or product for the mouth, what would be must-haves?
Must-haves would be activated B vitamins, because what we're seeing as we're evaluating patients here, especially because so many of our patients have chronic disease, we're seeing a lot of methylation issues, meaning the inability to utilize inactive forms of B vitamins. So B vitamins, number one. CoQ10, number two. And this is critically important for our patients who are on statins. We actually see changes in periodontal tissues. I've had patients that have been completely healthy periodontally, and meaning their gums are healthy, and all of a sudden we'll see a change. And when we quiz them as to what's different, they'll say, oh, my doctor put me on a statin a while ago. And we have seen pocketing and periodontal breakdown. So CoQ10. Vitamin C is critically important because vitamin C addresses free radicals. It's highly important. Vitamin D, the links between vitamin D and periodontal disease, dramatically. It's a dramatic link. And in the early years ago, when patients would come in with periodontal disease, I would send them back to their physicians asking for inflammatory marker, HSCRP, and vitamin D levels. And invariably in periodontal patients, we were seeing vitamin D levels well below 30. And then the final thing, of course, is probiotics. We have a great probiotic toothpaste that we use here, and we've actually had patients brush with probiotics. Zymogen has a product, Strep salivarius, that actually we use here in the office quite a bit for decay patients. So probiotics and then fish oils. There's actually a study showed that when a substance named Resolvin was manufactured from fish oil, by relieving the inflammation, it completely changed the bacterial flora. They didn't alter the bacterial flora with treatment. It was actually by removing the inflammation with fish oils that they were able to fundamentally change that patient's periodontal health.
I love it. So much knowledge here. And again, your background, your experience, it's just overflowing with all kinds of goodies for us. So Dr. Chalmers, how do we get more information about you or other websites? Can you direct us to any informational links?
Well, my website, www.meschalmers.com, is my practice website, and it tells you just things we do in the office, things that we look at, things that we consider important when you're going to be thoroughly examining, treating, and caring for a patient. There is the website of the International Academy of Oral Medicine and Toxicology, www.iaomt.org. It's a wealth of information on mercury, safe amalgam removal practices. There is New Directions Dentistry, and again, these links are all in that PowerPoint presentation that accompanies this talk. The New Directions Dentistry has the training videos to train dentists in how to implement these safe amalgam removal techniques. And I just need to say, it's not a large financial outlay for the dentist. It's a nominal expense, and the potential to not only change your patient's health, but benefit the health of dentists and their staff is really significant.
It is truly. So thank you again, Dr. Chalmers. This has been quite a gift to all of us, and we really appreciate, again, your sharing of all that information. And, of course, you have so much more, but we only have so much time. So we do thank you very much for being part of this.
Deanna, it was an honor and a privilege. Thank you so much.